EZL is a fungal infection. Horses can get it from wounds, especially when they're immunocompromised. It's very prevalent in Ethiopia, but we suspect it's in other parts of Africa, only it's not been diagnosed. So what we would see is injuries that progress up a line of the lymph and eventually spread around the body. From there, it tends to go in deeper in the body and affect the lungs. At this stage, it goes from being a severe welfare problem where we might act into what could be a lethal condition because the animal loses the capacity to breathe and eventually can die of asphyxiation. The treatment protocol for these horses is quite long and it's very painful, but most of all it's very expensive and it's not available. The drugs are not available in Ethiopia, so we have to ship them from the UK.
It is really a big welfare problem in this country, and horses are maybe about 18% of the horses in Ethiopia are affected, and it's really a big threat to the horses in the equine business here. Owners don't have any option for the treatment. There is no drug available anywhere other than the SPANA clinic, so the horses really suffer. But in the places where we are working as a SPANA, we are treating early cases.
It's a massive task, and we clearly, in the whole country, could do a great deal more than we do at the moment, although it's very, very positive work. We've got some fantastic staff here who are working really hard, but they are really drawn. They have a lot of work to do, and we need to expand in this country.
SPANA tackles EZL in many ways. The most direct route is through the mobile clinic, through direct intervention on the animals that present with the injuries. In these, depending on the degree of the disease, we have designed a protocol that is quite effective but very expensive, so not affordable by owners. This implies shaving the wounds, treating it with potassium iodide and iodine, and this is provided to the owners by SPANA. The drugs have to come from London, but they are delivered by our vets together with anti-inflammatories because it's a very painful condition. The other things that we do is we train owners, so we train them not only to understand what ways the disease can be transmitted, but also when to seek help. So we try and get them to bring the animals as soon as possible, or call our mobile clinics to go and attend their animals as soon as possible. We do community training activities, and we collaborate with universities both in the UK and in America to produce tests to diagnose the disease earlier on, and furthermore we're trying to do a study to understand exactly how the disease is transmitted across between horses and across the country.
Sadly, it's highly contagious, so we need to segregate animals that have got that, otherwise it's just going to get completely out of control. We've met an enormous number of people, both in the villages and nearer the cities, who are so grateful for the free veterinary work that SPANA provides. And then we've met a lot of people in schools, in communities, and in the education establishment I'm in at the moment, that are really grateful for the work we're doing on educating people on how to better look after animals.
So we train the owners. By training the owners, we try to reduce the occurrence of wounds. That also helps to minimize the transmission of the disease. The disease is really very terrible, and it's the biggest welfare concern in Ethiopia.
ፈረሱ በጣም የኔ ጠቃሚ ነው አለሱ በሱ ስለሆነስ መንቀሳቀስ ፈረሱን ራሴ ያስበልጬ ነው ማለት አዎ ተወሞት ይረዳኛም ብዬ ነው እዚህ የመጣው ሶስተኛ ቀኔ ነው መመላለስ እሺ በጣም ነው የማመሰግነው እነሱ በመኖር ነው ሁሉም ነገር በመኖር ነው አይደል ወደዚህ የመጣው እና በጣም ነው የማመሰግነው ምስጋናውን በተረፈ እንዴት አድርጌ እንደምገልጽም አላውቅም
I think the needs in a country like Ethiopia are massive. The work that we're doing is fantastic. The impact we are having is fantastic, but we need to expand. There's a great deal more for us to do, and any help that any donor can give, please come and talk to us. Go to our website, find out more about what we're doing, but please talk to us. We need help in order to expand our services.
So we want the owners to help us, the supporters to help us as much as possible combating this disease in many ways.
any support that donors can give towards the actual treatment of the horse or towards campaigns that can prevent this or teach owners how to diagnose it quickly or bring it to us soon enough would really be helpful.